This is Whiskey Bravo 5 Delta, Grand Rounds on the Air Net. We appreciate everybody being here with us today on the net. We hope that if you're listening on 20 meters, you will find it interesting enough to do check-ins as we pause during this interactive discussion and participate, because we're talking about the history of Tylenol, the evolution of an iconic pain reliever, tracing the journey and the impact of this famous medication, including past and recent concerns, an interactive discussion. You don't have to be in the medical field to join this discussion. This is pertinent to all amateurs. And the roadmap for discussion today, the dialogue, realize it's not medical advice that you can have with your medical team. They can assist you with your health decisions. Here, we're just talking as a group on our individual takes on the particular subject material. Some of us are in medical fields and some are not. Personally, I'm a dentist, so I'm not an expert, and I'll be asking on a particular subject, leading as a facilitator the discussion, and I'll be asking others to participate. But in this roadmap of discussion, we're going to be looking at the origins and discovery of acetaminophen, the introduction of Tylenol to the market, some of the major milestones and challenges, the impacts on healthcare and consumer safety, and recent concerns about autism and use during pregnancy. Now, the slides and graphics today for first for me, and I know those of you use AI quite a bit, but I actually used Copilot today to help with the PowerPoint design, with the graphical design. So some of the graphics that you see on the slides as you check our Healthcare Ham website that we use to prompt this discussion, as well as the copy and overall design for this discussion, was created with the aid of Copilot, but we've also enhanced it with original material and links to other online sources. It's not totally AI induced. What about the origins and discovery of acetaminophen? Early research into pain relief compounds, certainly in the late 19th century and 20th century, studies focused on effective pain relief compounds with improved safety. And there needed to be development of safer alternatives. As a safer pain relief alternative, you want fewer side effects. And there was includes focus on fever reduction in children, because at one point, and even currently, there are concerns about aspirin due to the side effects in children. And that's kind of less than in a gray area than Tylenol during pregnancy itself. By the way, the comments today are not political in nature. We're just laying out some of the background information. And again, they're not diagnostic in nature. They're not medical recommendations. But the discovery and chemical development of acetaminophen, it's a metabolite of two chemicals, and I'm not going to go into all those details, but I'm providing the links to everything here. And the pharmacological properties, it was identified for its pain relieving and fever reducing effects. Again, significant pharmacologic interest. And we're talking back in the 1950s too. The natural versus synthetic, in today's world, in some segments of society, there's not only a preference for naturally derived medications, but to some, there's an obsession. You have to realize that in all drugs, there's benefits and risks. There's a therapeutic index as well. So the public is aware of recommended dosages and packaging when it's an FDA, Food and Drug Administration, impacted product, but ingested natural compounds outside of these requirements are an issue as more. They're not necessarily better, and they can be toxic. So toxicity in the natural world, obviously you think of things like arsenic, and that's a natural compound, but when you start thinking about therapeutic index, which might be narrow in Tylenol, but when you're looking at water, you can have symptoms and toxicity from water, and you can die from too much water. So on the presentation, I've given a link to that information for those of you who want to open that up and look at it. Do we have any comments right now on 20 meters that anyone would like to make? Make your call to Whiskey Bravo 5 Delta. Stuart, do you want to come in through the Zoom link for the audio, please?
Would you want to define therapeutic index?
You want to go ahead and define it first, Stuart, so we have here a voice from someone else?
It's the ratio of the amount of a substance it would take to treat someone over the amount of the same substance it would take to kill someone.
Thank you, Stuart. And we'll hear and talk more about that in terms of Tylenol and some other substances. And we've had a digital net last week where we started to discuss this subject, and we had some interesting comments in regard to Tylenol and the therapeutic index, where people have gotten harmed intentionally or unintentionally. But brands and generic names, medication and name here in the United States is acetaminophen in the US and Japan. The generic version carries the moniker with the brand name being Tylenol. But as I found out on the T33A DXpedition, when I went to bring medications for pain relief, and of course I avoided narcotics in a 40-foot shipping container that was going to be met in Tarawa by customs. But I learned that it was called paracetamol with the brand name of Panadol in the rest of the world. So you can't necessarily go by the word acetaminophen if you're talking to friends in other countries. There is a link in the slides to what is acetaminophen versus paracetamol and its uses and side effects. Once again, those slides are available to those of you on 20 meters. Go to healthcarehams.org for that background. Do you have any follow-up comments, Stuart, on that? Go ahead.
I think that was a very good summary of a lot of information.
Okay, thank you. That was WA9ZPL with Whiskey Bravo 5 Delta, AA4FL at the microphone. This is the Medical Amateur Radio Council Grand Rounds in the Air Net, Whiskey Bravo 5 Delta for ID, operating out of Florida today. Do we have any other comments at this point from those on 20 meters? What about those on Zoom? Any comments? Well, we're going to continue the interactive discussion here. There's a lot of different areas of concern and information that we'll be discussing, and various individuals in our forum here, which basically is a forum, a discussion group, roundtable discussion group on 20 meters. You know, nets are collections of ham radio operators that share a particular passion or interest, and they're quite often, focused on a particular area. So we're a group of amateurs that have a passion for healthcare related topics. And not everyone in Marco is a healthcare professional. We have pilots, we have clergy, and we come from all different walks of life. We all have a vested interest in our health. So why not discuss that passion on amateur radio? What about Tylenol coming to the marketplace? Now, I don't see that we have too many elderly. Now, see, now that I'm older, I don't have to refer to myself as elderly in my age group. But we don't have too many 80 and 90-year-olds here. But is there anyone that remembers when Tylenol was introduced to the marketplace, personally experiencing it? Let's hear on 20 meters if anyone's familiar with that. Okay, what about on Zoom? Does anyone remember when it was first released in the marketplace? Okay, it would take a little older group here. I mean, the research brought it to the marketplace in the 1950s as a new pain relief medication. The key ingredient of acetaminophen provides an alternative to aspirin for pain relief and fever reduction. So it's an alternative to aspirin and different medical needs in reducing the side effects of aspirin that was commonly taken. And interesting enough, in irony to what's going on now, the focus at first was also as a liquid pain reliever for children, as early as the mid 1950s. So I'm surprised that none of us that are maybe 5 or 10 years older than I am, remember first being exposed. I remember things from my childhood. I remember when Frito-Lay, things like Fritos were first released. Maybe that's more memorable than being given some liquid Tylenol as a child. But early marketing strategies and public reception, it was important. It was new. You had to emphasize your safety and effectiveness to build consumer trust, and consumers positively received the messaging associated with Tylenol and pain relief. And from what I understand in reading, it was a prescription item at first. And then they moved from the developers bought out, I believe, by Johnson and Johnson, and the initiative was taken to be over the counter, to move towards over the counter. So, not to take what I say at face value, but we've provided links that you can read all the details without having to go on Google and do your own searches, which of course you're welcome to do here, those on 20 meters. You're hearing all the keywords here that you can search on. What about the expansion of the product lines? I mean, they made multiple formulations tailored to specific symptoms and needs. I think at times I've taken Tylenol for migraines. As to whether or not it's much different in the composition, if they compound and add different things, that's another issue. But as a dentist, I know we used a lot of compounded with narcotics years ago, when our philosophy was we didn't want anybody to be in pain, and we gave them what we thought was strong enough that they absolutely would not have it. That's not necessarily the truth, and the philosophy has changed greatly at this time. It's not what we teach dental students this day, nor is it what we do in private practice anymore for many different reasons. But targeting different age groups have different needs. Different age group demographics are important, from children to adult. And in a business sense, expanding product lines helped the brand reach more customers with diverse health requirements. What about major milestones and challenges? I'm going to pause one here for additional check-ins. I encourage all amateurs that are listening to check in so that we can have you join the interactive discussion and ask questions. Make your call to Whiskey Bravo 5 Delta. Make your call now. Okay, no additional check-ins at this time. In 1982, there was a Tylenol tampering crisis. Most of us remember that, where somebody put poison in bottles, opened them up on the shelf. And not that just happened to be Tylenol, it could have been on any over-the-counter medication, but there was widespread fear due to the cyanide contamination of consumer medicine capsules. So the company implemented a swift response to that to regain the public trust, and it led to new product safety regulations and tamper-evident packaging standards. That's why you see everything self-sealed or individually packaged now, and there's no ability, or very, very difficult to tamper and contaminate medication. Do we have any comments about that? Make your call to Whiskey Bravo 5 Delta. Is anyone on Zoom that would like to discuss that?
Tamper and contaminate medication. Do we have any comments about that? Make your call to Whiskey Bravo 5 Delta. Is anyone on Zoom that would like to discuss that?
Yeah, I hear someone else, but it's faint here. Can I get a relay, please? On 20 meters, can I get a relay? This is Whiskey Bravo 5 Delta. Go ahead and try again. Make your call. And this is the Grand Rounds on the Air Net. It's a weekly net on 20 meters and been on this frequency for many years. Thank you for those of you here on 20 meters that are monitoring and participating. We do appreciate that. So the implementation of tamper-evident packaging actually came in response to what happened here with Tylenol. So that's an interesting factoid. But the regulatory development and product recalls, it led to stricter packaging regulations and enhanced recall protocols as well. because obviously if something was tampered with, there had to be a recall on all the items. Otherwise, there would have been a chance that someone would have had a problem from contaminated medication. What about the impact on healthcare and consumer safety? We're starting to get into the meat of the subject here, getting close to what's going on in the public venue right now. But the role in over-the-counter pain management is a safe pain relief alternative for those who cannot use aspirin due to safety concerns or allergies. Tylenol's availability influenced global consumer health choices by providing that trusted non-aspirin pain management option. Stuart, WA9ZPL, would you like to comment on why someone would not want to take a lot of aspirin, whether it be a child or different reasons for an adult? I'll turn the mic over to WA9ZPL. This is Whiskey Bravo 5 Delta.
Well, with regard to children, during my career, we've seen a complete turnaround from the old days when baby aspirin was literally marketed for use by babies to the modern era where we say that no baby, child, or adolescent should take aspirin at all. And this is because of a rare side effect called Reye's syndrome, which involves severe progressive liver failure, possible death. Do you want to comment further about that from the dental perspective? Go ahead.
Thank you, Stuart. Not sure why we had a little bit of a power drop on your transmission there. We'll work on that. I see we've got the power on my microphone here, Stuart. So Stuart had mentioned the changes through the years in the perspectives that they've done on aspirin versus Tylenol. On the dental perspective, not so much the aspirin, but the narrow therapeutic index. And we'll talk about that in more detail. Dentists really used a lot of compounded narcotics with Tylenol in them. It was a standard for care back then, as I mentioned. And we'll talk more about that. Is there anyone on Zoom that would like to make a further comment? Anyone else on Zoom? Okay, go ahead.
You mentioned about therapeutic index. So the therapeutic index of Tylenol is somewhere in the range of maybe between 2 and 3, depending on various details. And in other words, someone could potentially die by taking 3 times the maximum recommended dose. And this is by far the lowest therapeutic index for an over-the-counter drug. Most over-the-counter drugs have a therapeutic index well above 10, as do most prescription drugs. And it's really remarkable how something like Tylenol got over-the-counter approval with such a poor therapeutic index. Go ahead.
QSL and well understood. And as we talk about that a little bit further in our upcoming discussion, we'll focus on that. But the story of how it was invented, you can see that online. There's a number of different sources that will give you a timeline. And if you want to look at those slides that we have on healthcarehams.org, those of you here in 20 meters, you'll have access to the links and you'll be able to go into everything in much more detail than we can discuss here in our roundtable discussion. But what Stuart just talked about is obviously extremely important. One has to be careful with Tylenol. We'll explain why that's an issue. And in the current context, you can see why that may have been red flags where they're talking about pregnancy and Tylenol. Not that that's necessarily a proven fact, but it's something that's being investigated. If it's got such a therapeutic index, it's so small, and the smallest of the small are those in fetal development. What about the clinical studies and efficacy? It's, everything is always going on, including that in pregnancy. Okay, compounding with narcotics And before we get even into that, we do have a psychiatrist with us here, N5RTF. And uh, Chip, if you can elaborate a little bit, I know with this low therapeutic index, which makes it very toxic if one would misuse. Were there times in psychiatry where you had someone that chose to commit suicide or accidentally take too much and just not be aware of the potential toxicity? Go ahead, Chip.
In psychiatry, we would speak of a range of suicidal behaviors, including completed suicides, of course, where someone actually dies, suicide attempts in which someone may have attempted to commit suicide but failed, and suicide gestures in which people do something which is a suicide-like behavior, but with the stated or unstated goal of getting attention. And the latter was something we would see a lot of times in young people, teenagers, and usually young women. And the Tylenol was used commonly because it was being over the counter. They assumed that it was safe, which was a terrible assumption to make. And I can remember some horrible instances of people that were brought into the emergency room after overdosing on Tylenol. Their stomachs would be pumped, but at that point, their liver failure was irreversible, and the primary physician would have to go in and explain to the family and to, say, a 17-year-old girl, that even though she felt fine right now, she was going to be dead in 2 days. And I remember those instances vividly. That was terrible. They've tried to educate people better since then. I think it's done well. I haven't seen a lot of Tylenol-related suicide attempts, and certainly no completed suicides with Tylenol probably in the last 20 years. So it does seem to be less and less common. So the word must be getting out. N5RTF.
Okay, thank you, N5RTF, AA4FL at the mic here for Whiskey Bravo 5 Delta, the Grand Rounds on the Air net. Yeah, well, suicide, of course, by Tylenol, and being that therapeutic index doesn't give a lot of safety, it doesn't take a lot of Tylenol to do liver damage, and that was a problem with safety concerns, because a lot of over-the-counter medications for cold relief also have Tylenol in it. So if you're taking Tylenol and don't realize that, and they've made, certainly a point to stress that, but they've also reacted to that by decreasing the amount of Tylenol in compounded items, particularly in narcotics. So the question for narcotics is a narcotic, say codeine with Tylenol, any stronger than just for pain relief in a dental environment, for example, than just taking Tylenol or an NSAID, a non-steroidal anti-inflammatory drug, something like Advil. And there's others that are more effective and stronger than Advil. So that's a question that was still a little murky, but most of the time after dental procedures, just dosing with a non-steroidal, non-narcotic anti-inflammatory agent's adequate. And what will happen is if you tell someone the limits of the medication to take, and it's every 6 hours, and you would say, well, if you have pain in 3 hours in between breakthrough pain, just go ahead and take a dose of Tylenol, but do not exceed, more than so much, 4 times a day, every 6 hours, basically, on the Tylenol. And of course, you also have limits on non-steroidal anti-inflammatory agents, things like Advil. There's side effects there too, so you by alternating it, it actually helps with both. But there was such and I think everyone knows this from reading in the mass media, that there had been a lot of lawsuits regarding narcotics being pushed at the therapeutic level to doctors who patients have gone ahead and gotten addicted, large money settlements. So we do live in a world where discussion is easier to come by and information can be spread more effectively. And hopefully that's all getting through. But they've also reduced when they do put Tylenol within the compounded or over-the-counter medications. They've often reduced the amount of Tylenol as well, so decrease that cumulative effect, because it doesn't take that many before your liver's affected. And if you have hepatitis C or some kind of cirrhosis or liver damage, I had a nurse patient one time who would know better. It had nothing to do with his dental procedure, but he did pass away from Tylenol toxicity. So it can be an issue as well, and everybody should be where you never want to use anything more than is necessary anyway, but you still have limits of what you can take. You need a different medication if it's not handling it. So getting to the meat of the subject here, the concerns about autism and use during pregnancy. I'm going to pause for one and just take some additional check-ins. And ID Whiskey Bravo 5 Delta Grand Rounds there, net AA4FL at the microphone here, operating out of Florida today. Do we have an additional check-ins? Make your call. So I'm not hearing any additional check-ins. I hope if you're listening on 20 meters, you're finding this to be an interesting topic. We are making a recording here that will be distributed on our YouTube channel, Healthcare Ham's YouTube channel, and you'll be able to share that with family members and friends. So what about the current research on acetaminophen? The researchers are investigating exactly how acetaminophen works at the molecular level to better understand its effects, because it's still not well understood. And I think that's part of the issue also with the neural effects. They really need to know how and why it works and what potential issues it could create. And that's true with science investigating autism in pregnancy, why the occurrence of autism is greater than in the past. But that's very complicated because it's multifactorial. And I did provide a link in the slides on the autism spectrum disorder, the definition, epidemiology, causes, and clinical evaluation. And that's available through a link. Just click on it. So science is ongoing, but for now, the balance of evidence shows that there's no causal link between Tylenol use and autism, but obviously it's a concern that's being discussed, and you're getting different recommendations from different people. So discuss that with your healthcare professional. What about autism spectrum disorder? Areas to consider. Advanced parental age could be a factor. I mean, many studies suggest that both advanced paternal and maternal age are risk factors for autism, as the likelihood of spontaneous mutations in sperm and eggs increases as people get older. And we certainly know that right now, over the last generation, individuals are often waiting till they're older to get married, and even older before they have children. They're getting established in their career. And there's even a 2016 study that suggests that young mothers, those under 20 years old, are increased odds of having a child. What about premature births, as we just said? More likely to be diagnosed with autism? What about diagnosis in general? Do we just focus on autism a lot more than in the past as a clinical diagnosis? Could that be part of the difference? What about maternal inflammation, infections, high fevers, immune activation during pregnancy? Could they play a role? And we know, and it's being stressed lately, folic acid deficiencies. That's something that's well known during pregnancy. But what about obesity during pregnancy, air pollution? How do you separate all that out and just say Tylenol is the source? And genetic studies would obviously help quite a bit, and have. And the result from what I've read, and you're welcome to read these as well, say that there is no direct connection when you look at those with similar genetic backgrounds, one that's taken and one that has not taken, and any difference, both have taken, any difference in the expression of autism if both siblings took Tylenol and only one got it. Let's see if anybody else would like to comment. I know Andy, WJ8B, are you with us here, Andy? Go ahead. Perhaps Andy had to.
Yeah, I got it. Yeah, I'm here. I
Okay.
couldn't get the thing to unmute. I finally figured it out, but for
Yeah, I'm going
Sunday
to turn the
morning.
mic over to you, Andy, and see if you would like to make any comments about Tylenol.
Okay, well, the biggest thing I ran into as a general internist and was actually the combination of Tylenol and narcotics. Because until 2009, I had a very active hospital practice. I didn't retire until 2018, but in 2009, that's when my hospital switched to hospitalist only. So we ended up not going to the hospital after that because of being a cost center for us if we didn't go and be able to bill. But anyhow, and I think Chip mentioned this earlier. The biggest problem when I saw Tylenol get toxic was when people would overdose on a narcotic that had acetaminophen in it. And most of the deaths that I saw from Tylenol were in that exact situation. Someone would take the high dose narcotic because they figured they'll take enough, they'll quit breathing and die, which would be true if they took enough. But typically, what would happen is they would do that. A family member would find them, call the squad, and the squad would get there soon enough to intubate them or get them an airway to get them to the hospital, and they would survive their narcotic overdose fairly well. But they'd taken so much Tylenol that anywhere from 3 to 10 days later they would expire from liver failure. And many of those patients were young. Of course, you mentioned some where they just took the Tylenol alone as a suicide gesture. That's probably even sadder. But and that's the issue with the neurotherapeutic ratio. The question is it doesn't how much harm is it at the lower doses and long term, and I don't know that we have studies for that. With autism, of course, there's a much broader definition of autism today than there was even 15 or 20 years ago. Many people say, well, there's such a high incidence of it. Some of that incidence is the broader definition of it, behaviors which may have been overlooked in the past as being just variants of normal and not autism or considered autism now. So it's a very complicated situation. So. And of course, you can get into the whole social thing about people delaying, marriage and pregnancy, et cetera. That's largely due to it's both social and it's largely financial in many family situations. So that's about all I have for now, Jay. Back to you, WJ.
Okay, thank you, Andy. WJ8B, AA4, Alpha Mike, Whiskey Bravo, Phi Delta, Marco, Grand Rounds on the Air, Net. And we do appreciate that input, Andy. So what are parents supposed to do? I mean, all medications have risk and benefits. That includes Tylenol. So for pregnant moms trying to wade through the headlines, where are we at? And this is coming from a group called the Local Epidemiologist, who has an online chat for here, and you can register for it. If you look for your local epidemiologist online, you can sign up to participate. So possible risks, there's inconsistent signals in observational studies, and some suggesting a correlation between Tylenol and autism, but they cannot prove that it causes it. The strongest sibling studies showed no causal link. That's the genetic studies that they go into detail on, and perhaps you can find those online other than from that source. But the known benefits, one of the few pain and fever relievers considered safe during pregnancy, and all other options have shown risks, not just potential. And treating fever during pregnancy is important because the fever itself is associated with increased risks of birth defects. So even been associated with increased risk of autism in some studies. So what are you supposed to do? Be in pain? I mean, common sense tells you if you do use it, don't use any more than you need of anything when you're pregnant. And I think you'll hear that from most health professionals. But again, discuss that with your health professionals. Don't take what we're saying as recommendations, just evidence for discussion points for you to pursue on your own. So not only one medicine or one exposure causes autism, and all evidence points to a constellation of factors with a strong genetic component. And the data to date has not demonstrated the causal link between Tylenol and autism. The American College of Gynecologists and Obstetricians recommends pregnant women use Tylenol if needed for fever or significant pain. But remember the context. The risk signals we've seen are small and consistent and likely explained by these confounding factors, and the risks of untreated high fever in pregnancy are very, very clear. Now, we hope that this discussion has been helpful to you. I've provided some links on the slides. If you go to healthcarehams.org and look at the posts, and you'll see that link in the slides. Some other clicks that you may want to make for considering options to not Tylenol when you open that PDF document is pain medication use during pregnancy, a 2025 paper. It's just the abstract. The full paper is not there. There's one on pregnancy outcomes and birth defects in offspring following non-steroidal anti-inflammatory drugs during pregnancy, systematic reviewed. So you also have to concern with, what are the other options, as well as a paper there on prescription of opioids in pregnancy and birth outcomes, a review of the literature. But please do use those slides, and thank you for joining us. For questions or comments that are not here on the air, you can contact us through our website, which is healthcarehams.org. Look for this discussion to be offered as a YouTube video on our YouTube Healthcare Hams channel. Do we have any late check-ins now or additional comments? Make your call to Whiskey Bravo 5 Delta.
W and ZPL.
November 4, Juliet Echo Lima on Zoom.
Norway 4 Tango Sugar Charlie.
Okay, we're going to try to get your audio here on from Zoom. We've got three individuals that would like to comment: WA9ZPL, N4JEL, and N4TSC. Let's start with Stuart. WA9ZPL, this is Whiskey Bravo 5 Delta.
I myself experience headaches about once a month. And I learned some time ago that I could take just one tablet of Tylenol, 325 milligrams, to obtain relief. And that was fine. But now, when I go to buy more Tylenol, I can't find the 325 milligrams. I'm forced to purchase a 500 milligram, and I don't know why the smaller tablet isn't available when we're dealing with the problem of a product with a poor therapeutic index. Over.
WA9ZPL, Whiskey Bravo 5 Delta. Yeah, I've noticed that there's a lot of extra strength of Tylenol, the 500s. I don't know why I'm thinking generic. I saw 325s, but that is the dosage that they reduced it to be compounded with narcotics when it's included. Again, the question means, does it add any benefit to a narcotic, or alone does Tylenol take care of it? You mentioned that severe headaches, Tylenol takes care of the issue, and you feel that you could take less than a single 500. And yeah, when we're talking about doses where you don't want to exceed. And so how many 500 milligram tablets, Stuart? Trying to remember what they consider to be the maximum safe dose. Do you know that off the top of your head? WA9ZPL, Whiskey Bravo 5 Delta.
The generally discussed limit would be 6 tablets per day of the 500 milligram tablets. However, for those over age 65, you might want to limit it to 4 per day. And also for those with pre-existing liver disease or with pre-existing large consumption of alcohol, you would similarly want to use the lower amount.
Okay, thank you. That was WA9ZPL with Whiskey Bravo 5 Delta. And next, Mike, N4JL. I'm going to turn the microphone over to you.
I have a similar experience to Stuart's. I'm surprised at how effective the regular strength, that is the 325 milligram dose of acetaminophen is. I use it for stenotic back pain, and 325 is more than sufficient for a therapeutic dose for me, yet the shelf space in pharmacies is completely covered with extra strength or stronger. I think there's an arthritis version too that's even more than 500 milligrams. It seems strange to me that the higher dosage is being marketed so strongly when 325 milligrams is great for me. And for JEL.
Okay, thank you very much. Appreciate your input there. So all of you that are listening, you can check that supposition, go to the drugstore and see what you see on the shelves, acetaminophen generic or Tylenol brand, and see what you find, if it's 325 or 500. And also when you're taking cold medications, look at those tablets and see how much is in them, whether it be a liquid cold medication or a tablet cold medication. And there's other areas that narcotics also the same. I believe there's only 325 in those now. You probably get them without. You'll talk to your doctor who prescribes your medications for you. Hopefully none of you are needing pain medications, but you can see that if you take quite a few, it doesn't take too many if Tylenol is included before you're at somewhat of a risk. We also have N4TSC with us. Jerry, would you like to make some comments? Go ahead.
Yeah, this is N4TSC. Some of the things that I would consider, first of all, since we're on this particular topic right now, of whether there's an association between Tylenol and other entities like the problem that we have with I've got a brain fart at the moment. I was just trying to remember what we were talking about, the association. In any case, the fact that there is a possibility that Tylenol may be associated with these mental deficits. The fact that the two exist independently doesn't mean that they're associated. If you'll recall, there was a term that we used to use of people that were called lunatics because they thought that the full moon was causing them problems. And the association between that was later on, and I think Chip can confirm this, determined to be just the fact that people were out and about when there was a full moon, and therefore there was more opportunity for these kinds of activities. So the association was indirect, it was not direct. And the fact that two things exist at the same time doesn't mean that they're associated. In terms of taking dosage, I usually try to take half of the dose that's prescribed just to determine whether in fact there are any adverse effects that I have to deal with. And as far as the availability of acetaminophen, it is available as 325 milligrams. I think that the 500 milligrams is a marketing ploy. And I had assumed that there might be a slow release version of it, but that's not the case. Therefore, when dealing with these medications, what I usually do is I'll take a look at the Tylenol, and you'll notice that there's a score on the back of it if you don't have a pill cutter. And so you can easily cut them in half and determine whether in fact the Tylenol is effective for you. The other choices, as we were talking about earlier, we talked about NSAIDs. NSAIDs, I believe, are cleared mostly by the kidney, and the Tylenol is cleared mostly by the liver, and that's why when you get to higher dosages, you get the liver damage. And personally, my own experience is I have a nephrologist who's taking care of my CKD, and he prohibits me from taking any NSAIDs at all. And the only time that I might have to take an NSAID, such as, for example, when there's a tooth problem, I will take it for a very limited period, maybe 1 or 2 dosage, because the Tylenol may not be effective. It turns out that there are 4 functions that are available for aspirin and other NSAIDs, including its function as a uricosuric and an anti-inflammatory, not just against the fever per se. And therefore, there are some advantages for aspirin. So anyway, these are just random thoughts. I'm sorry that I'm wandering a little bit in terms of commenting on the discussion that we've had earlier, but those are just some of the things that I would add to the conversation that we had today. Back to you, Jay.
WA9ZPL.
Go ahead, WA9ZPL.
There's one comment I want to get in before we run out of time, and that's that there is an overdose antidote to Tylenol. The drug N-acetylcysteine, also known as Mucormyst, can be administered to hopefully prevent the death from liver failure in people who have taken an overdose of Tylenol.
Okay, thank you, Stuart. I wasn't aware of that. I appreciate you bringing that up. And Jerry, you're right on target with your discussion. Thank you for the contribution. It was wonderful. I can personally relate to everything that you said, being that I also have nephrologists that does not have me taking the non-steroidal anti-inflammatory agents for that particular reason. And also on the dental front, where you mentioned that particularly you reserve it for those situations where the release of inflammation is important, because after all, teeth have a pulp, blood vessels in a confined space. And if you can imagine it being in a confined space, if it was inflamed, it has nowhere to go, and the tooth is going to be very painful just to touching or pressure, etc. So there's different modes of actions. Do we have any further comments on 20 meters? Do we have any comments or late check-ins? Make your call to Whiskey Bravo 5 Delta. Oh, Dave, thank you. I was looking forward to hearing from you, particularly comments about what's going on here in Vietnam and how you used it. Go ahead.
We're now writing protocols for IV Tylenol because it has a quicker duration, a quicker onset of action. That's one thing. IV Tylenol is much more expensive than the pill, but it can be administered. It's like $10 a dose. But a lot of our ambulances are using that now. And the second comment was on topical salicylates. One in particular, like Icy Hot, which has menthol, which opens up the blood vessels, and topical salicylates like methyl salicylate can be absorbed directly through the skin. They do, of course, platelets, so you can sometimes get bruising, but again, that along with a lot of the topical non-steroidal anti-inflammatory drugs like Feldine and some of those other drugs that people may recognize are very beneficial for pain control. We've gotten away from using a lot of narcotics because of those advances that are made. The IV Tylenol has the same degree of efficacy. Some people respond to it very well, and other people, of course, have a more limited response. So that was my comments. Go back to Ned. Thanks again.
Okay, thank you. What was the philosophy during the Vietnam years on Tylenol use? What was its usage then, Dave? KN0S, Whiskey Bravo 5 Delta.
Yeah, during was used fairly extensively. The acetaminophen was used in combination often with narcotics. It enhances the ability of narcotics, as you well know, like Vicodin and some of those drugs, hydroxycodone. Those drugs seem to have an increased benefit if you've added the acetaminophen to them, and that was used very extensively, again, to avoid the opioid problem with respiratory suppression. And back to Ned again. Thanks a lot.
Okay, thank you, Dave. Can 0S Whiskey Bravo 5 Delta AA4 FL
N5 RTF.
Chip N5 RTF. Let me turn the mic over to you.
Yeah, I just wanted to remind people about acetaminophen precursors. People who practiced like I did 40, 50 years ago remember phenacetin. Phenacetin was a pain reliever that was in some headache powders and I think Vicks cold tablets and some other things. And it was nephrotoxic. People would take more than they were supposed to. But before the liver problems ever kicked in, they'd start sloughing their kidneys. And phenacetin was removed from the market. But it was a precursor. It was broken down in the body to acetaminophen. And there are other substances, acetanilide, proparacetamol are also precursors that break down in the body to acetaminophen. I don't think they're used as prescription drugs, certainly not over the counter in the United States, but you could actually run into these things probably elsewhere in the world. N5 RTF.
W9NET.
N5 RTF. Yeah, we have W9NET with us. Have you been listening for a while here, John?
Don't you see my picture on the screen?
We were talking about Tylenol and pregnancy and use during pregnancy. As somebody who's OBGYN retired, tell us a little bit about Tylenol use for your patients when you were practicing and what you think of what's being discussed these days in current events.
Yeah, okay, Jay. Good morning, everyone. Jay, just one question first. Do you see my picture on your screen?
I do, and it's very presentable. That's why I'm not making any unusual faces.
Okay, well, I've been here. And I am grateful that you haven't immediately asked me as an obstetrician about this issue. There are a couple of issues that we have to deal with. And as you can see from this discussion that has been going on all morning, there are many, many more questions that have come up in recent days than before. And it's with these multifactorial problems and issues and things like that. It's harder and harder to answer a question with science. We all go to, we all get really good grades in high school, good grades in college, probably good grades in medical school and residency and all that sort of thing. And its purpose, I don't know if it was meant to be, but it probably was, with the purpose of this large background knowledge that doctors have that so many other I wouldn't call them subspecialties, but healthcare levels, mid-levels and that sort of thing don't have, is that we're supposed to derive, number one, a certain amount of theoretical knowledge to be able to answer questions by our patients, and also a certain amount of philosophical background to be able to answer such questions. And so obviously the pregnant patients, everybody says so on TV and everywhere else, ask your doctor, ask your doctor. Well, doctors don't know. And how could they? There's so much data and it's so complicated. So therefore, what I and what many practitioners fall back on is something called Pascal's wager. And it's sort of an older thing, and it doesn't have to do with medicine, but Pascal said, look, my wager is that you better believe in God, whether he's there or not. Because if you do believe in God and you abide by his instructions and so forth, you'll have a higher chance of getting to heaven. If you don't believe in God, you'll probably have a less chance of getting to heaven. So therefore, my wager is that you better believe in God, do all the good things that you're supposed to do, so that when you die, you'll have a few percentage points higher on your ability to get through the pearly gates. Well, it's the same thing with all this medication stuff. And so basically what we say to the patients is, look, nobody knows. We try to know, we have some theoretical knowledge, but basically the party line, and that's what ACOG says, the party line is don't use it unless you absolutely need it. And that sort of gets us off the hook. It puts the decision-making, to the patient in a framework that is rational and conservative. Another thing that nobody thinks of, well, actually, I think they probably think of it a lot, is that the obstetricians have to watch out what they say to people, because if you say something wrong, you get sued for it. Maybe not all the time, but malpractice issues are a major deal. So we try to be as conservative as possible, and there's a lot of issues regarding you take Tylenol to lower fever. That's nice, that's good. But the thing is, if you have a high fever, what does that really cause? Well, nobody knew if a high fever caused anything until hot tubs came along. And probably also because the internet came along with all the communication facilitation that the internet has brought in. People have been taking hot baths, saunas, that sort of thing for forever. So you see what I mean? It's enough to make you crazy. So I got out before I went totally crazy. But my point is that in the world of obstetrics, well, not me because I'm retired, but my non-retired friends that I've talked to get nothing but they have to do a 10-minute discussion with every pregnant patient that comes in lately because of this Tylenol issue. And that is an issue as well. So I think that for now, that's probably all I cared to say. And I appreciate the opportunity to discuss this, and there will be many more discussions. So back to you.
Thank you very, very much.
Jay?
Appreciate that, John. Yes, guys, this is Jerry, M4TSC.
Yeah, I have a continuing sort of thought process based on what Chip said and what David just said. he mentioned about APCs, the aspirin, phenacetin, and caffeine that used to be handed out during WW2 like candy. And anecdotally, it was or eventually they had a focus on the people who were watchmakers in Switzerland who took an enormous amount of APCs because of the very tedious, close work that they did. And they developed kidney problems. And that's when it was determined eventually that aspirin alone would be effective. Now, continuing on with what AI is, it will probably help us arrive sooner at a refined understanding much more quickly than we would have if we waited for these anecdotal things to develop and cause us to look and evaluate. So I would think that at the moment, since the evidence is not clear that there's an association between
Good
Tylenol
thought.
and these presumed side effects, that in my own case, if I were advising people about it, I would just say, we don't have any clear evidence that there's any association. Therefore, we will continue on the course that we have now until proven otherwise. But I think AI will help us look at the data that's there and be able to give us a better understanding more quickly than otherwise. Those are the only comments that I would have. Back to you, Jay.
Okay, thank you very much, Jerry. This is Whiskey Bravo 5 Delta for ID, AA4 FL to Mike. We're in our long-standing grand rounds on the air net, which has been on the air for an extended period of time on this particular frequency. It's a tradition every Sunday morning, being that doctors often were busy doing their hospital rounds more often on the other 6 days, and Sunday morning was a morning that they could participate and have a discussion amongst themselves about medical subjects. And historically, this was a continuing education venue in those pre-internet days. So thank you for everybody that's participated today. We're already over time here. So I'm going to bring the net to a close. I appreciate all the wonderful participation today. Certainly was extensive, particularly towards the end here, where we got into a lot of detail. This will be available as a YouTube video. And I'm going to stop that recording now.